You're listening to CDKL5 in color. I'm Marissa, and on this podcast, I'm joined by my co-host Amanda, and sometimes some very special guests to talk all things CDKL5 Deficiency Disorder. It's a rare genetic condition caused by changes in the CDKL5 gene. Patients with this condition often experience profound developmental disabilities, difficult to control seizures that start in infancy, cortical visual impairment, and a variety of other health concerns. It's a challenging condition, but we know that by sharing our stories, we can raise awareness, provide support, and paint pictures of our community that can lead to greater understanding and meaningful change for families like ours. Let's jump right in. Hey, Amanda.
Hey, Marissa.
How are
How's
you?
it going today?
Good. Doing
I'm good. It's good to see you. We haven't had a lot of FaceTime lately because you guys recently had a long hospital stay. And I want to chat about that today because my experience being inpatient in the hospital with Ava is a lot different than yours. We've spent time historically for med reactions, spinal fusion, EEG, neuro stuff, but not so much from everyday illnesses that we catch in the community. So I want to hear a little bit about all of that, and maybe you have some good hacks and information to share with folks about life in the hospital and transitioning home.
No, I think it's a good topic to talk about. We were in for 2 weeks. My son was diagnosed with flu A. I had a friend say, "What's flu A versus flu something else?" I said, "I don't know." That's what they told me he had.
There is a flu B.
There is a flu B. Yeah. It's so funny because, like you said, there are a lot of reasons why someone with CDKL5 might be in the hospital. And that's the thing about having a rare disease that impacts so many different systems in the body. It impacts your brain, it impacts your GI, it impacts your ortho and your respiratory and all of that stuff. There could be a lot of different reasons why someone spends time in the hospital when they have CDKL5 deficiency disorder. In the beginning of Gregory's life, we spent a lot of time in the hospital for EEG stuff, right? Trying to figure out the epilepsy. That was the big thing in the beginning. And I don't know if it's because as he's gotten bigger and his lungs are bigger, but we have struggled as he's gotten older, specifically with respiratory infections. And a lot of them are caused by common colds, right? That we all kind of pick up and that he picks up in school generally because, my husband works at home. I don't work, so I'm home. But he travels out and about and he goes to school, and school is a cesspool of germs. One of the things I really like about being hospitalized is that you learn what you're there for. So instead of like going to your pediatrician because your kid is under the weather and it's a virus unidentified, when you go to the hospital, they tell you generally what it is that you got. So we've been in the hospital for metapneumovirus, which is like a common cold, for rhinovirus. We had a huge hospitalization last year with RSV. That was horrible. And then this hospitalizations for flu A. And then, of course, we've had pneumonias and things like that. But finding out the name of the virus is always one of the highlights of being
in the
there.
hospital. Well, I call it just a virus when we're going to our pediatrician or primary care. That's always what we get.
I know some pediatricians will do like a swab for flu, and obviously COVID. I mean, we can all test for COVID at home, and we can test for flu now at home too. But my pediatrician historically has never done that. So when I take him to the pediatrician, we don't learn why he's sick. But we definitely do in the hospital. So that is a highlight because I like to, I like to know why we're there. Sometimes it's hard to distinguish. Does he have a pneumonia, like an aspiration type pneumonia, or is there a reason we're here? And so it always makes me feel better to know that there's a reason we're here than wondering if, oh my God, do I need to thicken more his stuff, or should I be doing more for secretions or something like that? So knowing the name of a virus that's gotten us to the hospital it's important to me. It's, when he had RSV last year, it was a Tuesday. He sleeps with a pulse oximeter, which shows his oxygen saturations, also shows his heart rate. So Tuesday, I went in there. Monday, everything had been fine. I went in there Tuesday to get him up for school. And I look at the monitor before I shut it off. His heart rate was 150. And so I said, oh, something's up. Otherwise, he looked totally fine, but his heart rate was super high. So I said, you know what? I'm not going to send him to school because something is up. And we were in the emergency room by 3:00 that day. It went so fast.
Good call, Mom. Like, you know.
That's the benefit of like doing some monitoring of your kid so you understand what their baseline is. Because then when something's way off, it clues you in to be like, wow, something's way off here. Because like I said, he didn't show any signs of being sick, but I kept him home. I'm glad I did. One of the hardest things is you go from this touch and go of, are we managing this at home? Are we not managing? Are we managing? Are we not managing? To, well, let me call the on-call pulmonologist. To, I know in my head when I call the on-call pulmonologist, they're going to tell me to bring him in. I know
Bring them
that's what's
in.
going to happen. But I
Just
always
in
still
case,
call
though.
them. Right. Well, I always still call them because what they do is they call the emergency room ahead of us and say, hey, these people are coming. And that makes my life easier. So when I'm hitting the call button to call the on-call pulmonologist, I'm also packing my bag to go and, doing all those things because you know how it's going to go.
What is in your bag? That is an important thing that I think until you find yourself at a hospital, not expecting to stay long, you don't think about a hospital bag. But the worst thing is to not have a hospital bag. So what's in your bag?
Yeah. The worst thing is to be stuck at a hospital and not have anything that might make
Yeah.
it more comfortable for you. So I have a big black bag in my closet, and it has a side pocket where I have some single dollar bills because there's a vending machine for drinks in the emergency department. So sometimes that has come in handy. And then I have a packed toiletry bag that has soap, shampoo, deodorant, toothbrush, toothpaste, things like that. Lotion, face lotion, hand lotion, chapstick, anything that might make me feel more comfortable if I was going to take a shower there. One of my comfort items is fuzzy socks, like comfortable socks. So I always have fuzzy socks in there. What I've learned is I'm a jeans person. I always like to wear jeans when I go out. But now when we're going to the hospital, I'll wear yoga pants and I'll pack yoga pants because they're just so much more comfortable and you can sleep in them. So oftentimes what I'll do is I'll sleep in my yoga pants and shirt and then change my top the next day. And then we'll keep wearing the same yoga pants until I take a shower and then I'll put a new pair of yoga pants on. And then this time I did something different, which was I should say I also had flu. I also had the flu when we were going with Gregory to the hospital with flu. I also had the flu. So I didn't feel well. And I brought a big insulated mug because I remembered they have family kitchens on the floors. And they're funny. They're these tiny little closet rooms where you go in, there's a refrigerator where you can put, like, if you get takeout or something, you can put it in there. I never do that because you never know if somebody's messing with your stuff. I'm sure they're not. But, like, there's other families on the floor who knows what she got to eat picking at your stuff. I'm sure nobody's doing that, but
You never know.
you never know. So there's a refrigerator, there's a microwave, and there's like plastic cutlery. And then there's coffee. It's so bad. You're better off having nothing than drinking the coffee that's in the family kitchen. It's so bad. But they have a hot water dispenser and they have tea bags. And so what I did every day is I filled up my big hot water thermos with hot water and did tea bags. It kept it warm for hours. And it was just so comforting. Like I wasn't feeling good, but also it gives you a little pick me up. Like anything, you're stuck in the same room all day. And you can leave, right? But I'm not gonna leave my son. I leave the room when other people are in the room. So if the nurse comes to do vitals or they're gonna give him a bath or they're gonna do something like that, that's when I escape. That's when I'll escape down to the cafeteria. That's when I'll escape to go get tea. That's when I'll leave the room to go for a little walk because I want somebody to be in the room with him. I understand he's monitored, so if he was desatting or something, they'd see that in the nurse's station, but it could take him a bit to get there. And if he's thrown up, right, it could just snowball
Yeah.
really quickly to be a bad situation. So I never leave him alone in the room. And sometimes they have PCAs on the floor, right, who are like the what's that called? Personal care assistant. So you could request a PCA to come sit in the room while you left. And sometimes I have done that. Like if I've missed my window to get out, I'll ask, can someone come sit with him for me to go? But, things like having tea. And then the other thing with that insulated tubs is the other thing. It was good for two things. One, getting the tea. But then also when I would go down to the cafeteria to get the good coffee, I would get two coffees. I'd put the one coffee in the insulated tin
For
and it would
later.
keep it warm for later. Yes. These are things I've never done on a hospital stay before. These were new to me. It's not rocket science, but it was new to me. And it really improved my, you know,
Experience.
experience being there. Yeah. Having a hot beverage, it's very comforting.
It's nice. With Ava, I can't leave without someone there because she has behaviors that need managed. If she's in the PQ, I can usually leave because there's a nurse sitting right there. But if we're on a general floor, it's not available. So, yes, it is stressful to be in the hospital, and it's the same four walls, and it's just the schedule of the hospital. It can be hard to feel at home.
Yeah, and being in the PICU is a newer experience for us. The first time we were in the PICU, I forgot to mention we've also been hospitalized for COVID. That was actually the first time we were in the PICU. Our experience with COVID was so crazy. So that was like 2023, so 2 years ago. We had COVID as a family. Thank God our symptoms were staggered because I don't know how we would have been able to care for Gregory at all. My husband got it first. He was very sick for 2 days. He tried to isolate in the basement, but we'd already all been together. So he was sick for 2 days. I cared for Gregory. Then I started to feel sick. I was incredibly sick for 2 days where I wasn't even coherent. Like, there's no way I could have taken care of Gregory. I could barely take care of myself. So he took care of Gregory. And then Gregory started showing symptoms. So the very first symptom was an incredibly elevated heart rate, which is always the very first symptom with him. He had a super high heart rate. And I called the on-call pulmonologist. I said, he's maintaining his oxygen okay. He seems like not too bad, but his heart rate is this, and I know he has COVID. And they were like, no, you need to go to the hospital. So, all right. So we went to the hospital. And in the emergency department, usually when my son gets sick, he has fewer seizures, or he actually has no seizures. Like, normally he has daily seizures, but when he's sick, he doesn't really have any. But with COVID, he had a ton of seizures, like a crazy amount of seizures. So they gave him Ativan in the emergency room. And after that dose of Ativan, he was still acting really strange. And I remember being in the emergency room, our little section, and it was my husband and I and the nurse who was on him. And my husband and I were talking about how strange he still was looking. And, the nurse can hear us. All of a sudden, the nurse was a man. He goes, oh no, yanks the thing out of the wall. I guess he didn't like what we were talking about, and he didn't like how he was still moving. So everybody comes rushing in, and they said, well, we didn't give him all the Ativan we could. Let's give him more Ativan. So they gave him more Ativan. Then they had to bag him because he wasn't breathing. Then they moved us to the resuscitation suite, which that was the first time we had been in the resuscitation suite in the emergency department, which is where they take, like, I want to say gunshot victims, or, they take like crazy stuff to the resuscitation suite. It's a whole like surgical suite. And we were there. So we got sent to the PICU because of respiratory when he had COVID, but not really because of the COVID, but because of the Ativan. And we only spent one night in the PICU, then we went down to the floor, and then we went home relatively quickly. But the difference between the PICU and being on the general floor is the amount of attention you get, right? Like, when you're in the PICU, somebody's in your room all the time. And actually, you would think that sucks, but I actually love it because there's always someone to talk to. There's always something happening, and you're getting lots of attention. And when your kid is really sick, it feels supportive to me to have a lot of attention. So I
Yeah.
remember when we had RSV, he was in the PICU for 16 days, I think. And then we went down to the general floor, and I felt like very alone on the general floor because people,
They have a
they
big
just,
caseload,
yeah, they have
actually,
more
on the
patients,
general
so they
floor.
don't see you as
Yeah.
much.
The first time we were ever sent to the PQ, Ava had a med reaction, something called dress syndrome, and it sent her on a very long course of steroids. And when we tapered off those steroids, she ended up with a bacterial pneumonia. And it progressed quickly. They took her by ambulance to the main campus, and I caught up with them down there. And so I arrive in her room, and she was comfortable and sleeping. And I laid down on the couch that makes a bed, and I went to sleep. And I woke up at 5 a.m. to them suctioning Ava. I had never had that experience. It had never happened, and her oxygen had continued to dip. And the nurse kept coming in and I'm like, this is not normal to me at all. So if you can't handle this, like you got to say something because we've not dealt with this. The PQ was busy and they were waiting for a bed to open. And in the meantime, they couldn't keep her oxygen up. And I transferred with them. We had to get in an elevator and go down like 5 floors. She almost went into cardiopulmonary failure because she wasn't holding her oxygen, even though they had it high. And so we arrive in the PQ for the first time, and they bring the crash cart in with intubation and with, things to shoot in her heart, in case her heart stopped. And I just stood there and was like an out of body experience. I could not believe what was happening. And they got things under control. And, anyway, the PQ is not a scary place. When you need it, you need it. I think that's kind of what I learned was like, okay, we should have been down here like this morning when they woke up. I should have been like, take her somewhere she doesn't get suctioned. Something's going downhill.
It's crazy how quickly things can
Yes.
snowball.
That was kind of the point to my story too, is like we went from, and that's the only time yet she's ever been in the PQ for lung issues. And she ended up intubated for like 7 days because she was full of these big mucus plugs that they couldn't get to move. So anyhow, so and I guess I say that too, because that was my worst, for me, spinal fusion was easier than that stay for her lung stuff. So I recognize how incredibly it's hard to watch your kid not breathe. What they have to do to get them to cough and clear and stuff is not fun.
I think what our kids go through, sometimes when your kid's really unwell, you're not sure how it's going to go. So
Mhm.
far for us, we've come home every time. But there have been instances where I've looked at my husband and said, I don't know what's going to happen here. And I don't like to throw around the word like trauma, but our kids go through trauma being
It's
hospitalized. I
true.
mean, we go through trauma with their hospitalization, but they go through it. Like Gregory goes through it hard when these things happen to him. When he goes on BiPAP support for his breathing, he has to be sedated because he can't tolerate it. So they put him on a sedative so he sleeps. Most of those beginning days of when we're in the hospital, he's just sleeping. But the deep suctioning, I have to help them. It's really
Mhm.
hard. You think, well, the medical staff, that's their job. So you don't have to get involved because that's their job. But realistically, you have to get involved. And when the respiratory therapists, I love them. They're wonderful people. I don't know who would choose to become a
I,
respiratory
I
therapist,
don't
but
either.
thank God for them. When they come and he'll tolerate his treatments, the nebulizers. He'll tolerate the shaky vest. I think he kind of likes the shaky vest, actually.
My Ava loves the shaky vest.
Yeah. But the cough assist machine, forget it. Deep suctioning, forget it. So here I am restraining his head so that they can get what they need to get because we're not getting out of here if he doesn't pass that stuff. Like if he doesn't get that stuff out, he's not going to get better. And it's hard. And I think as parents, we have to do things all the time that are not pleasant for our kids, but we have to do them because they need it to get better, to be safe or whatever. But it's like times 1,000 when your kid's in the hospital for a respiratory infection. And then what's really sad is it takes Gregory a long time once we're home to trust the people around him enough to not be on high alert whenever anyone comes near his face.
Yep.
Even if
It's
it's
moving.
myself or my husband. We get close to him after a hospital admission, he puts the block up right away because he doesn't trust me because I've been holding his head down for 2 weeks.
If it's not his head, it's his hands or,
Right.
you know,
It's sad. It's I don't know how else to do it though. I don't know what else
well,
to do.
and honestly, I think it's got to be, if I'm the bad guy doing the really, things that they don't want to do, I'm sure she's would rather me do these things than some complete stranger as well.
Yeah.
Not that she wants them done, but if we have to do something, I prefer to be the one doing the thing that's, probably scariest for her, which is whether it's right in her face. Even with Ava, like cathing her, it takes sometimes 4 of us to cath her because we will need someone to hold each leg, someone to hold up top, and then a nurse has to cath. And she's strong and she knows what's coming. There's nothing that makes me more furious than them being like, we didn't catch enough urine when we cath. I'm like, oh no. That happened once, and then I'm always like, how much urine do you have?
Right. Do you have what you need?
Do
Because
you
we're
have
not
what you
doing
need?
this
Because I am
again.
not coming back in to do this.
Oh my God, it's
And
so
I could never
true.
cath at home for that. Some people are like, oh, I cath at home. I'm like, no. I don't think me and another nurse could cath at home. I mean, it would be, a hard thing if I had to start cathing Ava,
Oh my
because that is
gosh.
sometimes a thing that people do, not just in CDKL5, but with neuro kids at home who have a neurogenic bladder. So anyhow, you don't think about the procedures, the collection of biofluids and things. Blood work is a piece of cake. Ava will watch them. She's good at it, but everything else, temperature in the ears, swiping her forehead, all of that is like, it's high alert, swapping, pulling their hair, stuff like
Yes,
that. So
exactly. And it's like, Gregory, the temperature is the easiest thing you're going to have to do, bud. But no, because he doesn't
no.
understand. He doesn't know what coming close is going to torture me or what coming close is safe.
hmm Plus, they can't see well. I mean,
Right.
not,
Yes.
I'm just, like Ava relies on her periphery vision a lot. So when you're right in her central vision, sometimes I know it's like, what is happening? So,
Yeah.
I mean, it's not funny, but sometimes you just have to appreciate the fact that they can rebel like they can.
Yeah, there is something cool about it. Because there
Yeah.
definitely was a season of Gregory's life where he was really out of it and wouldn't have put up much of a fight at all. So to see him fight is
Yeah.
it's good. I mean, he does
Yeah.
not have purposeful hand skills. He doesn't gesture or reach or grab or hold or anything like that. So, if he has the gumption to knock me in the face, I love it.
Yeah. Well, and that, when I get worried about like, are we going to go home from this hospital stay? I know the staff always tells me, they're like, she's still fighting. Like, you'll be going home, Amanda. And, in hindsight, like, that's a good thing to carry. Like, if they're still fighting, they're still fighting. Being in the PQ is awful in the sense that there are kids that don't make it home from the PQ, and you're all very close. In Denver, anyways, we have to share restrooms and showers. There's like 2 showers and 2 stools, or else you have to leave the unit. So one of my hacks in the PQ is I finally figured out where some staff showers were out on some general floors, and I would go really early in the morning and sneak into some of the doctor showers.
Wow,
So
that's cool.
yeah, check it out. That's a little hack for you when you're walking around at night.
Something that's nice about being hospitalized now is my son started with the palliative care team when he was around 3. So our children's hospital has a palliative care team. We met them when he was around 3. He was in a really bad spot when he was around 3, and we were having a lot of trouble even figuring out what was going on with him. The palliative care team helped me sort of coordinate conversations between his specialists, which was nice. And then he's been on their radar since
Right.
then. And so when we're hospitalized, they will come see us. And they travel in this little group. So it's the doctor and this one nurse that has curly hair. I mean, I know her name, I won't say her name, but they always come and see me when he's in there. And then last year when he had RSV, I'm a social worker. I made friends with the social worker on the PICU. So she comes to see me now when we're in the hospital. So I'm slowly building up my supply
Getting
of
your
people
friends.
who will come talk to me when we're in the hospital.
I mean, I'm lucky to be in Denver. Like Dr. Benke gets an alert in the computer system when anybody's seen in the clinic is over there. The nurse coordinator for that is a palliative care specialist. So they're kind of my team. It's not official palliative care, but it is nice to have people that know them when they're healthy come over and see them, and also talk with the hospitalist a little bit about what baseline might be, because Ava has a lot of ups and downs in baseline when it comes to things like heart rate and breathing. She's apneic breather. Sometimes she'll hold her breath and do weird things, and they are always there to help me. So it's good. It's good to make friends. It's good to make
No,
friends in
definitely.
the hospital.
And it's funny what you say about baseline, because another thing that I've started doing, and I did it last time when he had RSV last year, is I made a printout of pictures of him when he, like, riding his bike, doing physical therapy, playing baseball, like, different things that show him as somebody who not only has a life, but participates in his life differently than this comatose kid that's lying on the bed
Sitting in front
there.
of you.
And having videos obviously on my phone to be able to show people. But the nurses and the doctors, they appreciate it. And children's hospital is a teaching hospital, so we have a lot of, like, fellows and residents. I mean, I don't know what they're, I'm not up on, like, the hierarchy
You're
of doctors, but there's all these people, and it always gets a lot of attention. Like, oh wow, look how he does this, how he does this, and I think it does help paint a picture of your kid apart from they're at their worst, right? When they're
they're
in
at
the
their
hospital,
worst.
they're
Yeah.
at their worst.
Yeah.
Yeah,
And they're extremely complicated. So when you get these students, it's like throwing them into the fire, I guess. I don't mind the aspect of the teaching hospital, but there are times that you got to speak up and get to somebody with a little more experience to achieve your end goals.
yeah,
That's
absolutely. I think that's the most important role you have, apart from comforting your child, but being a parent of somebody who's in the hospital. The most important thing you can do is keep your eyes open and speak up when you see
advocate.
something you don't like, or when you want something different, and listen to them talk to each other, and see if something's not right, correct them, let them know.
Mhm.
Don't let them make decisions on misinformation. you
Yeah.
know I
Yes.
mean, pay attention to what medicines that, even their normal medicines, pay attention to this. How much Onfi is that? Oh yes, that's the dose. Make sure you're always looking, because mistakes happen. We had an incident where someone was going to give him something that he had already had. He only gets it once a day. He'd already had it in the morning. The nurses shift over. It should be in the computer, but stuff happens all the time. So whenever they bring his medicines in, I always go through them with the nurse before she gives them. You have to be on top of all of that kind of stuff and
All of
speak
it.
up.
And you have to be willing. Ava takes valproic acid or Depakote, and we do the extended release at home. We do sprinkles when she goes in PO. They have to switch to a liquid form, and then we have to go to Q4. We have to dose her 4 times a day. So even I have to set reminders because they are notoriously behind on meds. And I'm like, there is a reason we are giving this 4 times a day. So, like, please bring her valproic acid in. Medicine is important. A lot of things can change in the hospital. And I also, when you're on clinical trials, you have to bring your medicine. Bring your medicine when you have something that is not going to be able to be dispensed at a hospital. Even if you're on meds that you're getting from a specialty pharmacy, sometimes it's a good idea to bring them just in
Yes,
case.
absolutely. Don't
Like,
assume the
that needs to
hospital's
be
going to have
part of
what you
your
need.
bag, your little note of what to bag. Like if there are medicines you have a hard time getting, take them just in case.
Yeah, our clinical trial medicine, I have to bring that with me, absolutely. And it's so funny because sometimes they'll take it from me, label it, bring it down to pharmacy, get it approved for them to be able to dispense it, which is what they did last year. And then this year, for some reason, pharmacy couldn't approve it. So I had to give it on my own, which was fine. But, for everything as regimented as it is in the hospital, some stuff gets a little bit wonky.
Well, it's always our kids. They're complex and stuff they're not used to. And even if there is a process, whoever's there doesn't know it. And, I feel like usually in a couple days later, people come in and talk to me. Oh, this is what was supposed to happen and why. And which it's good. I never take it personally and I don't get too crazy until I've really pushed on something. And then it's like, I haven't slept and we've had this conversation 10 times. And, just either like, let's agree to disagree or let's figure out how to get past this.
I wanted to talk about what it's like going from hospital to home, because there's, like, this step down, right? So if you're in the PICU, you step down to the general floor and then you
Mhm,
go home. That's generally
mhm.
how it works. But going home, at least in my experiences with these respiratory illnesses, going home doesn't mean you're 100% better. It's another step down. It's another step down to finishing your recovery at home. So even though my son gets discharged from the hospital, it doesn't mean he's going back to school on Monday. It means he's still on his sick plan. He's still doing his respiratory treatments, shaky vest, cough assist, all that stuff every 4 hours. I don't do it overnight unless I have to, but generally by that point he's not needing it overnight. But you're finishing that recuperating and strengthening your lungs and getting healthy at home. And so, as much as it stinks to be in the hospital, and I mean, it is better to be home. Absolutely, it's better to be home. But when you're a primary caregiver for someone who's been in the hospital and is this, the step down is to continue to recover, and you have every 4 hours these things that you have to do at home, it's also a lot of work.
Yeah.
So my son, he was in the hospital for 2 weeks with flu A. He stayed home for a week, continuing a sick plan. He went back to school this week, and I hesitated. He's pretty much back to baseline. He's got a ton of energy. He looks great. He's satting good. Could he be satting a little better? Yes. But generally, I was like, I think he wants to go back to school. He's sick of being
Right.
home with me. So he's gone back to school, and actually he's doing fine. But when we got home from the hospital on Saturday, I didn't leave my house until I took him to school the following Monday. And some of that is like my own, could my husband stay for me to leave the house? Of course he could. But, I also like to be in my pajamas, and I don't really care to go anywhere. I could not have left the house when my husband's working, right? It's a lot of work. It's a lot of work to continue to recover a kid at home and for your kid to be on sick plan. And something that's different that happened this hospitalization is we got discharged with what they call a well plan. And that is not something that we've had before. So normally when my son is well, everything's great. He doesn't have nebulizer treatments, he doesn't have shaky vest, he doesn't have any of that stuff because he's well. But what they've said to me is he's going to have a well plan. So whereas his sick plan is three different nebulized medications, shaky vest, cough assist, every 4 hours, his well plan is going to be that once a day. And for me, that means thinking about the logistics of how am I going to do this every day? Because he's not home for us to just do it. He's at school. He gets home at 4 o'clock. We already have a routine for after school before bed. And now I'm having to fit in. I mean, it takes probably 45 minutes to do a session of his respiratory treatment. Where am I going to find these 45 minutes to do this every day? And it's not every day like a job Monday to Friday. It's every day,
Hmm.
7 days a week. It's 360. It's every day.
That's every day. It
Where
doesn't
am I
matter
going to
what the
find?
holiday, what the weather,
Doesn't
what the,
matter.
yeah.
Every day. Where am I finding this 45 minutes to do this with him? And I find that our life is so driven by routine. I'm sure yours is the same way. You have to have a routine when you have a medically complex kid. You have to, because you have so many things that are non-negotiables.
Yep.
Medicines are non-negotiables, treatments are non-negotiables, therapies are non-negotiables, standards non-negotiables, all those things. They're non-negotiables, and they're not things that you do when you feel like it or during the weekdays. They're things you have to do every day.
Mhm.
And it's just challenging.
Yeah.
It's part of the challenge of having a kid that lives with an illness like this, that lives with a rare disease like this.
Yeah. I mean, I'll throw in there in Colorado, I'm fortunate enough to be a paid caretaker for Ava. I have been since she got on a waiver. And it's medical, so I had to get a CNA license. And I work for a large home health company. So anytime we go in or out of the hospital, there's this added layer of case management. I have to let the nursing company know. I have to let the agency know that case manages her Medicaid waiver. And then when I come home, the nursing agency has to come out and reinstate those services based on whatever the discharge plan is and have all of that changed, in place as well. So when I'm getting out of the hospital, I have 48 hours for my nurse to get to my house. And so there are times when I'm trying to come home, and part of the discussion is when can the nurse be here so that we can reinstate services within 48 hours and avoid other paperwork that comes when you don't have that happen. So, nursing would be great for you to do at home. So some of this stuff you could have supports with, but when your house becomes a little mini hospital, it comes with a lot of other strings. It comes with another DME company that's calling me about the damn hours on the shaky vest. We manage the whole picture every day, all the time. And you get used to it and you get really far removed with how kind of wild it is to be in charge of all that stuff for one person and still have to go on and, do other things, clean the house, cook the food, do the laundry. I'm also facilities management. It's a lot. And the hospital just complicates. Time stands still when you're in the hospital. Everything is waiting for you when you get home. All of the things you should have remembered to do in the hospital at home that you didn't are the emergencies that are also blowing up in your face. I try to have everything on auto pay for bills, and there's things there that just slip your mind, and it's not like the world doesn't really, also they don't care if you've been in an alternate reality in the hospital. Like, they expect you to show up and do the things you commit to. You're burning the candle at both ends, always. Where is the tipping point? Like, how am I going to continue this?
Right. And it does feel like time stops for you, but
Mhm.
not for anybody else.
No, the world keeps moving.
The world keeps moving.
Yeah.
And, it's like when we got discharged and we got home, I have my desk set up on our dining table with my calendar for our podcast and, when episodes are going to go out. And I mean, none of that is anything. I mean, it's just for fun, but still, it's like, things
Mhm.
I had anticipated. I'm still back to February 1st, and everybody else is heading into March. You know,
Yeah.
it feels like you're still back picking up where you left off, but everybody else is 2 weeks ahead of you.
Yeah.
It's a bizarre feeling. And part of me I don't want to scare people who have little ones. But what I really love about doing this podcast is sharing these things for people who don't experience them and are listening. I think it's informative.
Mhm.
But those other moms, and I say moms because I'm a mom, but those other caregivers out there who listen and are laughing to themselves because they know exactly what we're talking about, that's who I love to do this for. you
Yep.
know? That's who I love to do this for. My friends out there who are in the same boat as me, who can identify with what we're talking about and just
You're
feel
not
that
alone.
sense of community. Right. You're not alone. This sucks, but you are not alone because, hey, it
Yeah.
sucks for me too.
Well, I think the contrast of our kids, I think sometimes people think, oh, if my kid was more like this. And I'm like, let me tell you what, it comes with all of the same stuff, and where we differentiate ourselves. What I have that's harder in some places, it's you have
Yeah.
the same that's harder in others, but none of this is ideal or easily
None of it
managed
is
or
easy.
or that kind of stuff. So
None of it is easy. No.
I've missed seeing you, and it'd be good to get back into the groove of podcasting now that
Yeah,
you're
totally. We got some good
home.
stuff coming up. So thanks for listening. We hope you'll follow us on social media at CDKL5 in color on Instagram, Facebook, and LinkedIn, and visit us online at www.cdkl5incolor.com. Have questions or a topic you'd like us to chat about? Would you like to be a guest on our podcast? Email us cdkl5incolor@gmail.com, and we'll be in touch. Until next time.